Welcome back, everyone, to Montgomery County's Engage at Home, brought to you by the county's Caregiver Support Program. Today, we are with Briggitte with the Aging and Disability Services Resource Unit with Montgomery County. She is a highly talented professional, and I've asked her here today to provide an overview of what is the Aging and Disability Resource Unit. Welcome, Briggitte, and if you could please introduce yourself.
Thank you so much, Lily. Well, hello, everyone. My name is Briggitte McLean, and I work for Montgomery County Aging and Disability, the Resource Unit. And I've been here a while, Lily. I don't know if you know that actually it's going to be close to 5 years in the county and in this program, actually, which I have enjoyed working. And I'm here to share with you basically what we do, so you kind of have a general idea of our services. And I'm a social worker, as you know, by degree, and I definitely enjoy working with the community and providing information and resources that would be needed.
Excellent. It's great to have you here. And I know that you've put together an amazing presentation. So I look forward to sharing that with our viewers.
Hello, everyone, again, and I'm going to be talking about Montgomery County resources and services. And this is through our program, Aging and Disability. And this is a short presentation that is going to give you an overview and just to have an idea of our program. So I'm going to start with basically this presentation that talks about aging and disability. And our main number, as you see in the screen, is 240-777-3000. And also to let you know that we are located at 401 Hungerford Drive on the 3rd floor in Rockville, Maryland. And I also have our hours of operation, which is Monday through Friday from 8:30 to 5 p.m., Tuesdays, Wednesdays, and Thursdays, phone only until 7 p.m. And during the weekend, you should contact the crisis center. But one thing that I want to clarify is that due to COVID, we are not serving the public at our office. So I will encourage you to call our main number. We provide the same services over the phone. We will make sure that you get the information that you need, and feel free to call us. And just for safety precautions, we have to abide by, the rules of contact and what we need to follow through to be safe. Okay, so next, what I wanted to show you is, when do you call our main line? When do you call the 240-777-3000 line? One of the main reasons why a lot of individuals call it, whenever there's a concern of elderly abuse, neglect, self-neglect, or financial exploitation, or any safety concern that you may have of an elderly person or an individual who is an adult and has physical limitations. So there's some concerns of safety. So you call us in and we take those phone calls. And what we do is, whenever those phone calls are taken, we forward them to have additionally assessed by our social workers. So that's one of the reasons why people call us. The other reason is because we also provide information about resources in the community for elderly people, people with disability. And the other reason is general information that we may have, that individuals may want to know. What do we have in Montgomery County for this population? What can we offer? Okay, so I'm going to have this presentation now that it basically talks about different aspects of assessment, especially when we are talking about adult protective services. Okay, and there are two circles that you see here. Okay, let's go to the one that basically talks about aging and disability, the resource unit, where we provide information, assistance. The simple assistance means that we can connect you with resources in the community and outreach and different things that you may want to know. The other part is the adult protective services. This is when I was initially talking about any safety concerns. So what happens whenever there's some concerns? This is evaluated by the intake unit of adult protective services, and then evaluations are done about what would be available for these individuals, if there's any safety concern, what can be done, and all of that will be evaluated in a deeper way. And people who usually call us are the individuals themselves, family members, the medical community, the police, fire department, friends, relatives, any other people who may have any concern are welcome to give us a call so we can provide the assistance that you may need. Okay? So whenever we talk about making a report, one of the things that we want you to keep in mind, okay, that is important. Whenever you make a report, you can remain anonymous if you don't want your name to be known or be disclosed. You can definitely make that request. But it's important for us to at least have an idea of the name of the individual that you're trying to report, at least to know where is the person living. And if whenever sometimes we don't have that information, it could be a little more challenging to make a report. Just to understanding of what is the nature of the abuse, the neglect, or the safety concern. And anyone can contact Adult Protective Services. So what we want you to know is just to gather a little more information if possible. But even if you don't have much information, we still encourage people to give us a call, just to make sure that you are addressing any safety concerns. So helps come in different forms, okay? And there's another reason why also individuals call our main line. And one of them is to provide assistance to caregivers or individuals who need care at home. And there's different forms of care, and we call the in-home care. Medicare offers limited services for individuals who have Medicare. If they have, I believe, a doctor's note, if they have been admitted to a rehab, they could be possibly approved for additional care at home. And that's something that you have to check with your benefits with Medicare. Just keep in mind that some individuals also purchase advanced plans through Medicare for assistance at home or long-term care, and sometimes you purchase and you don't remember you have it, and at the time that you want services, you may forget. So I always encourage people double check what type of Medicare you have, what type of plans you purchase, which would be very helpful. There are programs from the state, like the community option waiver, that you can also call and ask about if you need assistance at home. The county also has a program that is called in-home assistance services, and feel free to call us so we can take your information and provide information about these programs for assistance at home to the individual who needs care and to the caregivers. And we also have the respite program, and the number is right there on the screen. So I just want to encourage people to make sure to give us a call whenever you have questions about what resources are in the community regarding to in-home care. This other part of the presentation is talking about Medicare and Medicaid, just to make sure that you know the difference. As you can see in the screen, Medicare, it's usually people when they call, they say, oh, it's the one that has the red and blue line, and that would be correct. And Medicaid, that is basically from the state. So there are two different things. So just want you to remember that. And just to also let you know that there is a program in the county that they are the experts on Medicare, and they can definitely assist you with a lot of questions that you may have about Medicare. And this is the Senior Health Insurance Program, and the number is 301-255-4250, the SHIP program. So make sure that you call them if you have any questions. And regarding to Medicaid, just to keep in mind that Medicaid is for individuals who are eligible because of their income. It's income limited. So if you have additional questions about Medicaid, feel free to call us. They have a Medicare cost saving that is known as the QMB and the SLMB, and we can give you the details of Medicaid whenever you give us a call. And just to also keep in mind that if you do not qualify for Medicare or Medicaid and you are a senior in our community, make sure that you call us because you may be eligible for community clinics. And that's something that it would be available for you whenever you need that type of assistance. So please feel free to give us a call. And also for any needs of mental health, especially for seniors who are bedbound, we have services that it can be provided. So again, give us a call. Regarding to food and nutrition, we have Meals on Wheels, and also other sites that they provide food assistance, especially now with COVID. We have different resources in the community that they provide assistance. So please let us know, whenever you have questions about especially this food distribution, now that especially the senior centers are closed. And also, if you are interested in applying for the food assistance through the state, the food stamps, if you may be eligible for that program, you can also give us a call and we could gladly assist you with mailing you the application, or if you have additional questions. But just to keep in mind that any application that is regarding to food assistance, to medical assistance, Medicaid, QMB, SLMB, all of that is processed through the Office of Social Services from Montgomery County. So that's something just to clarify, because our office do not process those applications, is the Office of Social Services. Okay, regarding to financial assistance. Financial assistance is something that individual give us a call regarding to what type of help is there in the community. And this comes actually through services like the rental assistance program. If you do qualify, they will assist you with your rent with a limited amount. Just keep in mind that right now, I believe there's a waiting list for services. Also, there is the Maryland Energy Assistance Program for individuals who are having difficulty paying their electricity, their gas bills, their applications that they can submit. We also have the Senior Care Fund for any assistance that you may need. For example, there's something that your Medicare and Medicaid may not cover, and you may need help. I'm just, thinking about, sometimes people call about adult diapers, that's something that is covered, that there's some need for this. And just keep in mind that all of this is income, you have to be income eligible for that, okay? And the homeowner credit, owner tax credit, that's something also that you can apply. And there are other organizations in the community that may be able to also provide assistance with financial aspects. I believe the city of Rockville and the city of Gettysburg, they also have some additional help. So whenever you have questions about that, please give us a call. There are other additional services in the community like transportation, and the numbers that you see on the screen are for those services. Whenever you need a ride for an appointment and you're unable to have someone to help you, give us a call, or you can also contact the numbers that you see on the screen about transportation services. And just keep in mind that for some of this, you have to follow through an application process. For example, for Metro Access, you need to complete some forms, you need to submit with additional documents so you could be eligible for these services. Okay, so I just wanted this part, I wanted to kind of make it a little clear regarding to transportation, because for transportation services that are offered through Medicaid, they only offer services for medical transportations only, and individuals who are eligible for Medicaid transportation. Okay, so you have to apply for that. For call and ride, is the same thing are for individuals who are low income and with disabilities. And for Metro Access are for individuals who are disabled, okay? And for all of this, you need to submit applications, and we can mail you that in case that you need it or you want to apply. Okay, so we're talking about now housing. There are different housing options in Montgomery County, but let's keep this in mind. They are the ones that have a cost attached to it, of course, and the other ones that are through Montgomery County Housing Opportunity Commission. We do have a listing and booklets um, of basically assisted living facilities that you could look. It would vary the price on how would be the cost and things like that. But for individuals who have more limited resources regarding to housing, we encourage them to contact the Housing Opportunity Commission. We also have a group home subsidy from the county. If you have any questions about it, please give us a call. But just to keep in mind, housing in Montgomery County can be limited, but still, we encourage individuals to apply, to call us, to ask questions, and so we can direct you in the best way regarding to housing questions. There are other forms also of services. There are some nonprofits that provide assistance to seniors. There are adult daycare services, home health providers, friendly visitors program in our community. And again, whenever individuals call us, we do a little more assessment. We ask additional questions just to understand the situation of the individual and see what would best fit their needs. So I always tell people, please give us a call. Our staff will gladly spend time with you, talk to you about what services are in our community. So this, I'm going to the end part of my presentation, and there is again our main number, 240-777-3000. My name is Briggitte McLean. You can call this number and ask questions. We are happy to assist you, happy to answer anything that you may want to ask related to services in our community. And again, feel free to call us. We are here. So this would be the end of my presentation.
That was an amazing presentation, and I'm always impressed by all of the resources and supports that are available through Montgomery County. This program is specially designed for caregivers. And can a caregiver who's a friend, a neighbor, maybe someone who's in a congregation or a relative call on behalf of someone who they're concerned for?
Definitely. Everyone is welcome to call, because many times, you know, we have individuals in the community who are very concerned about someone's safety, or they see something that they're concerned about, or, you know, they want to ask questions, and they can always give us a call. You know, especially if you're trying to access this information and resources, even if you kind of like suspect that something is going on and just want to run it by us, we always encourage you to give us a call, and so we can answer questions. And of course, based on whatever information you have and we have, we can work together to serve individuals in our community, especially our seniors.
Thank you. And remind everyone, what is the number for the ADRU?
Sure, our number is 240-777-3000. And just to keep in mind that after hours or during the weekend, you call the crisis center number, which is 240-777-4000. If we don't answer the phone or the crisis center doesn't answer the phone, please leave a voice message. There's options there to leave a voice message, and we will pick up whenever we return to business days, and we will return the phone call. So we always encourage people, give us a call.
Thank you. That's good information. So obviously there's people who may have complex situations. They may be not sure about what benefits they or a loved one qualify for, or they could be calling about particular services. Is there any advice you have of how someone should get ready before they call you?
Definitely. So what I was always encourage people is this. First of all, if you are concerned of the safety of an individual, it's important to at least have an idea, of the name of this person or where they live, because whenever you are calling us, and to give an example, someone calls and says, I think there's a senior who is in danger, and we ask, do you know the name? And they say no. Do you know the location? And they say, well, I think they kind of live here. So it's a little difficult for us to really know how can we enter information that actually would be difficult for us to make a report. So it is important that if you, at least to gather a name of the individual, where they live, just to have an idea, especially whenever there's safety. The other part that I also want to encourage you is if you are asking for resources, okay, and there's questions about, I want to know if this person would qualify for this or that. Um, of course, with the permission of the individual, okay, you could probably ask, because sometimes we will ask questions about what are their finances? Do you know anything about any income they're receiving from any fundings, retirements, and stuff like that? Because a lot of the services that we have, even though they are great, to keep in mind, they have to be income eligible for some of our services and a few of them. So if you don't have that information, it's okay. You can always give our contact number to the individual who's inquiring for questions, or maybe the family member, the son, or someone who has a legal role in their lives, like a power of attorney or someone who has that information, and they can call us. So we can talk to them about services, we can ask questions about their income, and based on that information, provide the resources that may be available in the community.
Yeah, great advice, because I know that it can get challenging for particularly family or friend caregivers. They're all of a sudden put in a position of having to help someone, and if they have as much information as possible when they make that call, it really helps our staff, doesn't it?
Yes, it does. It definitely does. And we also are very respectful following our HIPAA laws, our privacy laws, regarding to what information can be shared. And we also want to protect your information. If you don't feel comfortable sharing your information, it's okay. You can say, I want to remain anonymous, and we will make that noted. So we are always careful about privacy. So again, feel free to contact us to make that request, and we will work with you.
Thank you. So we're at the end of our time together. Your presentation was amazing.
Oh, thank you.
Any final thoughts or advice that you give to our viewers in relation to aging and disability services?
Sure. What I always tell individuals is this. I want you to feel comfortable to call us, because we are here to serve you. And the other thing that I also want to say is that um, every case is very unique and is assessed as a unique matter. So they are situations in which individuals have called us, and we have done assessments, and provide the needed resources because of the uniqueness of the situation. So even though my presentation is very general and it may not maybe address the needs that you think you may have or the questions, I always encourage individuals to please call us, because whenever we talk to you over the phone, we will have a more understanding on your situation, on the specific situation, and we will do more a detailed assessment to understand what is exactly that you may need and how can we guide you, how can we provide you resources, or what can we do to assist you and in a unique way. So that's what I always say to everybody and to every individual. Please give us a call. Let us help you in a very unique way.
Thank you. So thank you again, Briggitte. You have been a wonderful guest and a terrific presenter.
Oh, thank you.
This has been Engage at Home, an episode brought to you by Montgomery County's Caregiver Support Program. The resources and links and phone numbers to the Aging and Disability Resource Unit are going to be included in this episode's description, so please look for that. If you have any questions regarding this presentation, please contact Montgomery County's Aging and Disabilities Resource Unit on 240-777-3000. I thank you all for joining us here today, and as always, I remind you to stay calm.